This video will explain what colonoscopy is, why you should do it, and the possible benefits and risks. The information in this video is important because it will help you decide whether or not to have this test. If you decide to do a colonoscopy, when you come for this test, the doctor will ask you to sign a form that confirms you understand and agree to the test. Two of the most common reasons for having a colonoscopy are: 1. Investigate symptoms such as bleeding, diarrhea, or pain, and 2. Screen for colon cancer. Colon cancer screening is done on people who do not have any symptoms but are at risk of getting cancer. This includes people who have had a poop test, called the fecal immunochemical test, or FIT, which found tiny drops of blood in the poop. Screening is important because it increases the chance of detecting cancer or precancerous growths early, when they are more likely to be cured. Most patients receive sedation for the test, which is medication that helps you relax. This will be given through an intravenous, which will be placed in your arm. The sedation may affect your ability to remember the test. The goal is to keep you sleepy and comfortable, but awake enough to follow instructions during the test. Anytime a person receives sedation, there are risks including decreased breathing, low blood pressure, and irregular heart rhythms. Rarely, patients can develop an allergic reaction or pneumonia, which is a type of lung infection. To monitor for these side effects, your breathing, blood pressure, and heart rate will be checked by a nurse before, during, and after the test. If you have concerns about the level of sedation, please contact your doctor's office ahead of time. During the colonoscopy, a long flexible tube called the colonoscope is put into your rectum and passed around your colon. The camera at the end allows your doctor to see inside of your colon. Air is often put in the colon to help the doctor see. This can cause temporary bloating or discomfort. Polyps are small growths that sometimes lead to colon cancer. If found during the colonoscopy, they may be removed. Biopsies, which are tiny samples of tissue, may also be taken. Both of these can lead to minor bleeding, which can almost always be controlled during the colonoscopy. However, delayed bleeding is possible up to 14 days after the test. Colonoscopy is mostly low risk, but as with any test, complications can occur. 1 out of every 1,000 people who have a colonoscopy will have a major complication. Major complications include making a hole in the bowel wall called a perforation, as well as more serious bleeding. A major complication may require you to stay in the hospital for surgery, blood transfusion, or other treatments. The last risk to mention is the risk of missing something important, such as an advanced polyp or a cancer. This is very rare, but it does happen in about 1 out of every 1,000 people who have a colonoscopy. Carefully following the bowel preparation instructions to make sure the inside of your colon is as clean as possible will help your doctors get a clear view and make it less likely that something important will be missed. Please note that you will spend approximately 2.5 hours at the hospital. You will arrive an hour before the procedure to get ready for the test. The colonoscopy takes about 30 minutes. The remaining time will be used to monitor you after the test. It is our hospital policy that an adult accompanies you home after your test. Your ride must be arranged ahead of time, and your nurse must confirm that this has been done before the test begins. A taxi or rideshare service does not meet criteria for a responsible adult escort. If you have questions, please let your endoscopy nurse or your doctor know on the day of your test. You can also contact your doctor's office ahead of time with questions or to talk about other options instead of colonoscopy.